My hope for this Affinity group is for lay leaders and pastors to feel supported and equipped to support families who are touched by special needs. Leading this group really birthed out of my own personal experience with having 2 kids with special needs and trying to figure out how we fit in our local congregation. And so I'm not an expert on special needs. I'm not a special ed teacher. I'm not a behaviorist. I'm simply a mom, and I happen to be a social work professor who cares about the local church and wants to equip the church to serve its people well.
Our affinity groups are meant to connect people who have affinities for different topics. So for instance, we have affinity groups for pastors, people that are going through the same ministry context together, understand each other's burdens and joys in a different way. And so this one is specifically for people who care about helping churches care for families with special needs children and with children dealing with mental health issues.
My name's Jenn Hollenberger, and I'm an associate professor of social work at Grove City College. I have a PhD in social work, and I also got my master's in social work. And I worked as a clinical social worker for about 15 years before coming to the college, working with a lot of individuals struggling with mental health issues and struggling in their communities. And I just really have a heart for serving people, and then what brought me to Grove City was to integrate my faith into that context. So the Special Needs and Mental Health Affinity Group was birthed out of this realization that churches need support and how to support their congregants well. There are a lot of families who aren't churched because of some disability in their family, whether it's a physical disability or an invisible disability like a mental health disorder or a disorder like autism, for example. And they don't feel comfortable going to church, or they don't feel like they belong in church. And so the hope for this group is to support congregations so that they can help people feel accepted and welcomed and loved in their churches, regardless of their disability or their ability.